So hello viewers, wonderful evening again here for all of us at Marrow. We have one of the NEET-SS super rankers with us. We have Dr. Himanshu Chauhan. He has secured rank 3 in NEET-SS. So in the first 3. So great. Congratulations, Dr. Himanshu, from all of us at
Thank
Marrow.
you, sir.
I'm Dr. Riddhi, I'm the critical care faculty at Marrow, and today we are going to know all about him, how we managed this wonderful rank. So firstly, Dr. Himanshu, huge congratulations from all of us.
Thank you, sir.
For your wonderful rank. Obviously, as viewers, everybody would want to know a bit about your background. So where you come from,
Okay, sir.
what training you have done till now, and how you decided to go ahead and decide to pursue critical care as a specialty.
Okay, sir. Sir, I did my MBBS from Rajendra Institute of Medical Science, 2015 batch, during which I did a month investing in the critical care unit of RIMS, Ranchi, following which I took a drop year. After drop, I joined the General Medicine Department branch of Darbhanga Medical College and Hospital, Bihar. And following which I gave my after going through my MD theory exams, I did my I cracked the NEET-SS exams this sir.
So you did your MD in medicine, right? So and
Yes,
obviously, I do see people coming from medicine background who also like do some fellowship in critical care, but not many people are actually interested in doing DM or DRNB or like pursuing it as a full specialty. So why did you choose critical care? Like obviously, since internal medicine, you have a lot of options, right?
Yes, sir. I have pure medicine. There are a lot of options. Sir, while I was doing my general medicine residency in EMCH, I realized that the OPD patients were not capturing my interest. I was getting bored by it. I was getting frustrated by it. I was not really interested in a lot in seeing them. But during the IPDs and during the emergencies, I was really interested in seeing patients that I could clearly and very well diagnose in some way or the another. So I decided, at that point, when the time came for me to choose a super specialty branch, I started researching the counseling, and I saw this branch, critical care unit, critical care medicine. And so I started researching it. I started asking some seniors of mine about this branch, and I realized that this is clearly a beautiful branch that everyone should actually know about and actually should practice. Following which, they also held that none of the other branches on the mainstream medicine was piquing my interest. I wasn't really interested in cardiology. Nephrology was interesting, but the patient morbidity in CKD was a little disheartening for me. I felt like gastroenterology was not interesting to me. So I decided to focus all my efforts to securing critical care medicine and ICUs. And my seniors also helped in it. Dr. Kamal sir from in RML, he's doing his third year residency right now in RML. Yes, sir. That's how I chose the branch.
So when you decided that, okay, I'm going to pursue critical care, obviously you were not working in critical care, right? But you still decided.
Yes, yes, sir. I did not. Yes, sir.
No, go
Yes,
ahead.
sir. I wasn't working in. Yes, sir. I wasn't working in critical care. I did not have much or that much experience in the intensive care units. Uh, but after the first year was over, and I had some time, and my juniors had come and they had taken off some of the workload, and it was time to become serious about my future in a more tangible way. After researching it, I realized that I cannot half-ass anything. That I should give my full efforts to one thing that I truly want. So after seeing that and seeing the subject, I saw that I think before 2 years, the critical care was part of the general medicine subject, I think.
Correct.
The general medicine exams 2 years ago. So it was very inspiring to see that it wasn't a very high cutoff, but such a beautiful branch getting picked up in hospitals like RML, VMMC, CMC, Vellore. So I decided that this is a branch worth pursuing for me at that time after doing first year.
Because obviously this is very wonderful, because generally what happens is that when I interview toppers, I generally find that people who are actually working in ICU, they generally tend to have some advantage because they are seeing these patients on a regular basis. So some background knowledge always helps the exam. So how, because you were not actually doing it, so how did you actually prepare, or how did you plan your strategy? when you had to
So I
face?
would tell you, it was an uphill battle. I saw your interviews with the other of us, but my seniors that you interviewed, and all of them were working in ICUs, and I was really scared about this. That I'm not working in ICU. I don't know about pulmonary artery catheter. I don't know about cardiac output monitoring. I don't know about ventilator settings. But I buckled up. So I started where everyone should start at seeing your videos. I started seeing your videos on hemodynamic monitoring, on oxygen monitoring, and in oxygen monitoring. And I started watching your videos on monitor, and I had to see those videos at least 2 or 3 times to realize why you were firstly I was a little confused. What are you trying to teach? But after seeing this video, I because I did not know what ICU was, that what I'm supposed to do in the ICU. So after seeing those videos and then some subjects you took, because the videos you took were pretty comprehensive and involved all of the subjects that were created in most of the subjects that were critical care. You took a lecture on coronary artery disease. You took a lecture on AKI. You took a lecture on chronic replacement therapy. You took a lecture on liver. You took a lecture on ARDS and lungs. You took a lecture on pneumonias. You took a lecture on infections. So seeing this, I realized that this is just my medicine, and you are just upscaling it and telling me through the lens of the ICU. So after that, got back on the monitoring videos. Okay, I realized you want us to monitor the patients, how it is, every value, every point you have not meant to see. So after seeing that, I started more reconciling in my mind that what the ICU actually entails, what it means, what do you have to do in there. After seeing that, so I got a background of it from your videos, that okay, what the ICU is supposed to be. Then it was not time. I cannot just watch the videos, as you also say. You cannot just watch the videos, as Dr. Nair also says. You cannot watch videos and do the thing. You can be a very good clinician doing that, but you cannot solve the MCQs doing it. So then came the second part of the uh, battle, that was MCQs. And sir, I must commend you on the Marrow MCQs. They took some of the questions from your MCQs and they put it directly on the exams. They took one of your question on ECMO. They one of your questions during that warfarin question with rifampicin, in which the rifampicin causes bleeding due to inhibition of metabolism of warfarin. So some of the solutions were directly from that. So I got that background. Now, the third thing that really helped, sir, because for me, because I did not work in the ICU, I needed an environment that could stimulate, and I did not have any access to go into another hospital. So I needed to stimulate a battle and have a partner with me who I can talk to about. So in that, I took a Chat GPT Plus subscription, and and I ran that subscription into the ground, sir. So as I saw everything, I uploaded your notes and asked him to simplify it. I uploaded the topics that you taught and asked me to tell me what you want me to learn from these topics, because generally you wanted to learn, you cover everything, but I knew for a fact that in the MCQs they would only ask few things. So I wanted to know what will you ask. Then the third thing, that sometimes the Marrow questionnaire were a little hard, so I asked it to do MCQs, and then to make me 50 MCQs every day, and I did those MCQs, and through that I learned about the inotrope management, the ARDS management, the ventilator settings. What were the ventilator settings? You were trying to, what were the ventilator settings that you wanted me to learn? You wanted me to be an expert in. Through that, I asked them to make me more notes of other topics that I felt that I was not good at. And so through that, and I especially asked her to tell me. So it was a very interesting time. I could ask them questions that what might the teacher ask that I am going to miss, and it's gonna give topics. And some of the topic helps. It gives you just confidence. So sorry, yeah, it was mostly a three-pronged approach from my videos, your MCQs, and Chat GPT.
Right. So I guess obviously this year there were a few questions on AI in critical care, as one of the toppers was telling me in NEET-SS. So probably you are the one who actually introduced AI in your preparation as well. So that is quite fantastic. But how was the
Yes.
questions? Like how was the question pattern in terms of your NEET-SS? How did you
Sir,
practice?
question patterns. Sir, I do not remember, because I do not remember that, because I do not want to. I did
No,
not know
general,
what rank I
general.
was gonna get.
Yeah.
It's a general idea. The questions, if someone has studied, you have to just buckle down and use your knowledge and your logic especially to answers. I mean, they asked what is the problems that we are having, that critical interventionists are having doing research in cancer patients in the ICU. So definitely there was two or three options, four options. The person would be disheartened seeing those questions, but you have to face logic and that what might actual problems that may arise in the ICU that would inhibit an interventionist from doing research regarding cancers. So you mark that answer as like the maybe the caseloads or the patients. Similarly, there was a questions on CCTV cameras and something I didn't know about that hand hygiene being monitored from electronics. I did not know it, but through logic and by ruling out, I did not know we can monitor through electronics, but through logic and elimination, I came up with the answer. So some of the questions were like that. I thought something that you cannot actually miss, but of course you have to have a general good idea about you have to have a good idea about what the ICU is really about. You need to know about the hemodynamic monitoring. Some of the questions were really simple. Some of the questions did not take much of your mind's bandwidth to answer. You could quickly mark them. Some of the questions educated guess you need to. So the questions were definitely doable from a perspective of a person who only did theory exams, who only studied for theory.
Right.
Yes, sir.
Now that you have got rank 3, right? So in terms of options, you will be like flooded with options. So what have you decided? Have you made a decision regarding where you want to pursue?
Yes, sir. There was no decision to make. RML Hospital, Delhi.
So
It
that
has a
is where
very
you are
good
headed.
super specialty program. My senior is there. It has an older program than Safdarjung. I think the Safdarjung program only started 2 years ago, and I want to stay close to home in Delhi, so there's no choice in that.
So you are from Delhi, basically?
Yes, sir. Yes, sir. I'm from Delhi.
Oh, okay. So then you'll be basically be at home, and then obviously Delhi I think doesn't have any bond as well. So 3 years of DM, and then you don't have to serve any compulsory bond or something in Delhi if you're doing your.
Sir, I have just come home from college and doing all that stuff. So I didn't research it, but the preliminary research, I think there is no bond yet. There was some bond in MD, I think, but still.
But that also is an advantage, because if you do not have to do a bond, once you have finished your degree, you are like done. Then you can just pursue whatever you want to in future. So the other thing I wanted to ask you was regarding like in terms of your exam preparation, MCQs and all you did only from Marrow, the grand tests and all.
Yes, sir. More question banks and Marrow GTs. Marrow GTs also helped. I gave every GT exam that you prepared for us in the critical care unit, and especially I know you cannot answer all the question in GTs, but I came to know what you wanted me to do during those tests. You wanted me to apply my logic, even the things that a person does not usually read about, and be prepared with the mindset of anything that the paper might throw at us. So yes, I was GTs and a Marrow, and of course ChatGPT. The simple questions, one-liner to hammer in the information completely, so that you do not forget. Because Marrow GTs are very clinical and very good for the hard questions, but sometimes you need just the hammering of the same type of simple questions, one-liners. So that AI helped.
And like, were you watching other faculties' videos as well? Because you are from medicine background, so like, did you subscribe to Marrow even when you were like doing your MD medicine? Did you MD
Uh,
medicine?
Sir, I subscribed to Marrow after by completing my first year of residency in the MCH.
Okay.
So after subscription, I wanted to know. It was time to start learning about medicine also, because you cannot just, as Nair says, you cannot just read a book now. Uh, uh, that a great faculty could have read that book and simplified it, made a 2 hours video at, and it will learn it forever. So I started watching Dr. Nair's video to actually get the handle of what general medicine wanted from me. Following which there was following which I started deciding on what branch I was going to take. During which I realized that general medicine, critical care medicine was basically has been captured by general medicine exam. So I was really happy that by Dr. Nair's videos, I was be able to crack that exam easily because the same topics will be the same, and I could get
Right.
that. So I started doing those videos. I complete almost all of the Dr. Nair's videos, following which the big blow came for me. It's not for other people, for me. In
They
as you
changed the
know,
exam.
as you might, yeah, they changed the exam pattern in mid-Feb. Now I wanted. I had seen some of your videos on topics that I did not that were more relevant for the clinical practice, and that helped a lot. But I hadn't started on your whole video cache to as a complete preparation strategy. So the doctor. So after they took the exam from the general medicine side and made a completely different exam, now there was no choice for it, so I knew that I had to start at the preparation exam. So I started seeing a bit of your videos. At first I thought that the critical care exam would not mature during the first exam, during the first test enough to be clearly critical care, and some part of general medicine would bleach into it. But when my seniors had when the first exam happened that my seniors gave and saw the question, I was really taken aback that how sophisticated the question have become. Literally every simple topics that I have already learned had been asked, and one point above that has been asked already. They asked about autopsy during the first exams. They asked about pulmonary artery catheter during the first exam itself, and all of the topics that they are about MDR infections during the first exams itself. So at that point, I realized that I need to up my preparation. That the exam is not that simple now. You have to they want to hand me this in a silver spoon. That other candidates might be serious. So I started hammering in those topics, looking at niche topics, looking at simple topics, going through your video caches, any new videos you posted, any new videos I used to devour angrily. Sometimes used to exercise and see your videos so that I can be done with the videos and then make some notes of my own. Because so yeah, I think I had only had a 38 chapters of your videos, and then you suddenly make 20-30 notes, 30 videos more. So I had to make notes for them separately. Then you started giving out more videos. I was tired, but I was really inspired that you're still making videos for me about burns and the recent video you made about extracorporeal therapies in sepsis. So I started making those notes also. I started seeing those videos. So I completed my notes like that.
Yeah, because recently there have been questions about ECMO and stuff. So I thought I might as well add some of those videos for trainees. Because nowadays they are asking, especially in both INI as well as in NEET-SS, they are starting to ask those things. But obviously, anyways, wonderful talking to you, Dr. Himanshu. I think like your approach has been fantastic because I would find it very challenging, to be honestly, clearing an exam where I'm not working in that particular subject. So even without actually working in an ICU, obviously you had a medicine background knowledge, so that obviously helps. But again, there are salient differences between practicing medicine and practicing critical care, which obviously you would have understood a bit during your preparation as well, and maybe something that you're going to understand even more when you actually pursue it as a branch. Because critical care, as you mentioned before as well, it's a lot of physiology that is there in action. So that I also find it very fascinating, just like you. So welcome to the branch, and I really wish you all the best in your future. I know you're going to be a wonderful intensive care physician, critical care physician, and obviously you're coming to Delhi. So Delhi is a happening place. Apart from the pollution there, everything else is superb. You'll get good food. You're close to your home, so that is also an additional advantage. So, and obviously, if I come to Delhi, maybe we'll catch up sometime, or maybe we'll catch up in some conferences or something.
Okay, sir.
So, congratulations to you once again, Dr. Himanshu. Wonderful talking to
Thank
you.
you, sir.
And from Team Marrow, we wish you all the best for a rocking future.
Thank you, sir. Thank you so much, sir.